Thank you for your interest in Povoxin. Povoxin is an antimicrobial delivery system for use by dental professionals. Povoxin contains 2.5% povidone iodine in a reversible hydrocolloid matrix. Povoxin is radio-opaque, so it's possible to view its placement on a radiograph. Povoxin is supplied in 3 cc syringes with 2 cannulas for dispensing. Each box contains 25 syringes. Each syringe contains 2 cc's of Povoxin. The extra space is required to allow for expansion during the heating process. Povoxin has a shelf life of up to 2 years. Povoxin can be stored at room temperature. Here's a summary of some of the main features of Povoxin. As you can see by the chart, Povoxin is effective at killing a variety of microbes, including bacteria and bacterial spores, protozoans, fungi, and yeast, as well as many common viruses. Because there's no use of antibiotics, no antibiotic sensitivity is possible. Radiographs can be used to confirm the placement of Povoxin, and each syringe can be used to treat multiple sites, and in most cases, the entire mouth. In addition, Povoxin can be used for sustained irrigation, a procedure that will be explained later in this presentation. A dry heat conditioning unit is available for the proper processing of Povoxin. Povoxin needs to be heated in order to liquefy. The dry heat conditioning unit will liquefy up to 4 syringes at a time. It will then condition it to the proper temperature for administration. Povoxin can be held at the conditioning temperature for up to 48 hours. Povoxin can be heated, cooled, and reheated up to 3 times. Here is a patient with moderate to advanced periodontal disease. Antimicrobial treatment was indicated for 35 different sites. Sites that were treated were 5 millimeters or greater in depth and are indicated on the periodontal charting with red and yellow bars. It requires less than 1 syringe to treat all 35 sites. The entire procedure took less than 3 minutes to complete. Here is a case demonstrating the radio-opacity of Povoxin. We're looking at this area on the lower right side. Specifically, we're treating the 6 millimeter pocket on the mesial of tooth number 31. As you can see in the before and after radiographs, the pocket is completely filled with Povoxin. Note, the base of the pocket is 2 millimeters above the bone. Remember to allow for the thickness of the connective tissue and epithelial attachments. Let's take a look at a few videos demonstrating the use of Povoxin. The first video demonstrates removing Povoxin from the dry heat conditioning unit and preparing it for use in the mouth.
For the proper use of the dry heat conditioning unit, be sure to carefully review the instructions. When the ready light is no longer flashing and is a steady green, Povoxin is ready for use. Select the tip you wish to use. In this case, we are using the sustained irrigation tip. Remove the syringe from the dry heat conditioning unit. Point the syringe up and away from anyone, and remove the syringe cap by turning counterclockwise. Place the appropriate tip on the syringe and use immediately.
This next video will demonstrate placement of Povoxin into the periodontal pocket. In this demonstration, the hygienist is using the fine periodontal tip.
For placing Povoxin into the periodontal pocket, either tip may be used. However, using the periodontal tip will allow more control and precision. Plan out which sites you wish to place Povoxin and move from site to site in a smooth, steady motion. Insert the tip of the cannula to the base of the first site. Express the Povoxin through the cannula until you begin to see the material at the crest of the gingiva. Povoxin is designed to solidify as it cools. It will tend to solidify first in the tip where there is the least amount of thermal mass. For this reason, it is best to keep the material moving continuously. Remove the tip from that site and move to the next site, repeating the procedure. There is enough material in each syringe to treat multiple sites. The larger irrigation tip will allow more working time and can be used on more than 30 sites. If the tip of the cannula begins to solidify, remove it from the mouth and point it over a piece of gauze. Push hard on the plunger to force the cooler material out and return to the mouth to continue treating sites. Using this technique, precision placement of Povoxin is possible in multiple sites. Remember, a continuous flow of material when using the periodontal tip helps prevent the material from solidifying within the tip.
This last video will introduce a new procedure called sustained irrigation. In this demonstration, the hygienist will be using the larger irrigation tip.
When performing sustained irrigation, it is best to use the larger irrigation tip. Irrigation with Povoxin is identical to traditional irrigation, with the exception that Povoxin will remain in place for an extended period of time. Keep the tip of the cannula inserted subgingivally throughout the placement procedure. Follow the contours of the gingiva while continuing to express the Povoxin into the sulcus or pocket. You will see a continuous bead of the material along the gum line. It is not necessary to express a large bead along the gum line. The areas where pockets are 5 millimeters or greater should be treated with the pocket placement technique prior to performing sustained irrigation. A single syringe of Povoxin should be sufficient to irrigate the entire mouth. If desired, you can wipe away excess material with a gauze pad prior to the material cooling off and solidifying. Be careful not to pull the material out of the sulcus when wiping off the excess. This is especially important when the material begins to set.
Here are a few general guidelines to consider when using Povoxin. Each syringe of Povoxin is intended for single patient use. Cycle time for the dry heat conditioning unit is approximately 15 to 20 minutes. Syringes can remain at the conditioning temperature up to 48 hours. Syringes can be reheated from room temperature a maximum of 3 times. Patients should avoid eating for at least 1 hour after sustained irrigation. Patients should avoid home care in the areas where pocket placement has been done for 2 to 3 days and avoid hard, crunchy, or sticky foods. Thank you for taking the time to learn about Povoxin. If you'd like more information, please scan this QR code or visit us at jstdental.com/instructions. To place an order, visit jstdental.com or call 1-833-POVOXIN.